Dr. Nessim here, and in this video, I want to talk about residency match, and everything that goes into it. So the residency match, which happens in your fourth year of medical school, is definitely one of the most stressful points in your career. This is the time where you're going to figure out, are you going to get into that specialty that you so desired? And is another big hurdle in the overall process of becoming a doctor. Now, at this point, you'll be graduating medical school, so you will be getting that degree, that MD or DO degree. You will be able to call yourself doctor. But the question is, will you be able to be on the path to be board certified in the specialty that you want? And this can vary based on your specialty. So some specialties in general are less competitive, and most likely, if you're applying for it, you're going to match. Other specialties, not so much. So you always have the common competitive specialties: orthopedics, dermatology, plastic surgery. But now even other specialties are becoming more competitive, and then it's dropped off. My specialty in particular used to be not as competitive, and now it is. So that's physical medicine and rehabilitation. Every year there's 1,000+ applicants now, and there's only 500 to 600 spots. And so that means a lot of people are not going to match in at least their desired specialty. Now, you can apply to multiple specialties, but you have to be careful with that, because if your application screams one specialty, then that quote unquote backup specialty might not like that you're clearly applying to them as a second option. And so now that's the reality of what happens if you're applying to competitive specialties. Sometimes you only apply to one and then you just reapply the next year if it doesn't go your way. Some people will apply to multiple specialties in the same cycle. But overall, what can you do to optimize your chances of getting in? So first, of course, is doing well in your preclinical years. Grades wise, some medical schools are graded. So if it is, that's very important. If it's pass fail, it's not going to be as important in the beginning. But that's when then step comes into play. And so now step one is no longer graded. When I took it, it was towards the end of when it was graded, but now it's only step two that's graded. And so step one, you need to make sure you pass, ideally on the first try. A fail on step one is not going to look good if you're trying to match it to a competitive specialty. And then you have to have an awesome step two score. I mean, can you get into these competitive specialties without one? You can. I mean, usually you have to hit a bare minimum score. A lot of times there will be cutoffs, but you don't have to have the best score in the world. But if you're trying to match competitively, then it is important your step two score. So making sure that you're studying the right way, using active recall, spaced repetition, doing practice questions very early on, really dedicate the right amount of time to study for that exam. It's going to be very important. So getting that score, doing well on your clerkships, what people say about you and write in your Miss B letter and your recommendations, that's important. And so being proactive on your clerkships and being a star med student really helps. Now, how do you do that? Well, it's definitely a balancing act, because you don't want to be too overbearing as a med student. I've seen students that try to one up the interns or the residents and, show off how much knowledge they have. And sometimes it's going above and beyond in a good way, but other times it's not necessarily in a good way. And so you have to be very careful. You are walking a fine line as a med student. And so really what I would suggest is be proactive, show up on time, be prepared, offer to help when you can, or if you see opportunities to help, bring up, hey, do you want me to go speak with this patient's family? Do you want me to go get the vitals for this patient? If you can write notes, writing notes is very helpful for the residents, and then they can take over and check your notes. But these types of things, if you are proactive and you show initiative, it really does make a difference. But you're not trying to outdo the resident or intern on rounds and make them look bad, because I've seen that, and that's not gonna go over well either. And then on the flip side, you don't want to be the resident that is showing up late, doesn't seem to care to be there, even if it's not the specialty that you want, because you're going to get graded in all your clerkships. And so that's very important. Obviously, shelf exams, studying for those go into this as well. And so you want to make sure you're prepared for your shelf exams, because that usually combines with the feedback and grading you get in your clinical rotations to get your overall grade for that block. And so, if your school is an honors high pass system, then getting honors, especially like if you want to go into a surgical field, getting honors in surgery helps. Now, can you get high pass and still match? Of course you can. It's not the end of the world. Nothing is ever the end of the world or as bad as it seems, but you want to be doing your absolute best. So that's, now you're doing your clerkships. And then lastly, now you're moving into fourth year. What can you do? And that's going to be doing away rotations. Now, there was a time where away rotations were kind of going out of style during COVID. It was hard to get them. But I would say for more challenging specialties, like orthopedics, for example, I think doing away rotations is generally a good idea because programs like to know who they're bringing in and matching. And so if they've worked with you for a month and they really like you, even if you didn't have the highest ever step 2 score, they might rather you over someone with a slightly higher step 2 score, but they know you and they know you're going to be a good fit into that program. And so that's why doing the aways can help. Now, they could also hurt you on the other end of the spectrum if you don't do a good job. So it's a fine balance. But I think overall, doing multiple aways, especially if you're going for a competitive specialty, is important. I spoke to a friend recently. He's doing 4 aways in ortho plus his home rotations. That's 5 overall ortho rotations. That's going to be a more challenging year than someone maybe that's trying to match internal medicine and doesn't really need to do aways at all. But it might be hopefully worth it at the end of the day. I know he was saying that some people are even doing 6 aways, which I think is crazy. But if you want to get your face out there to multiple programs and increase your overall chances, sometimes you got to do what you got to do. I don't think you have to do that many, but for these specialties, I think aways can make a difference. I know that at our program in physiatry, which is getting more competitive, a lot of times we match students that have done aways at our program. And so that's another thing that you could do. And same principles apply for the away rotations. Be eager, be helpful, but don't try to outshine your residents. Don't try to come off as you know more than you do. I think that sometimes will rub the residents and then sometimes the attendings the wrong way. And again, just be an asset, be someone that's pleasant to be around, and someone that we can envision working with next year as you come on as an intern or as a PGY too, depending on if you're a categorical or advanced program. And so overall, that I say is some of the things that you can work on to improve your chances of matching into whatever specialty it may be. Of course, other things like research is important. I don't think it's as important as some people think. I think being able to talk about your research and having maybe a few projects that you really did a lot versus 50 million poster presentations is more impressive. Maybe you get a big manuscript, 1 or 2, that looks really good. But it also depends on specialty. Some specialties care more about research, others don't. Lastly, anything that you're doing outside the box, I think also can serve as an asset on your application. So if you've started a club in medical school, or you do mission trips, or you still play competitive sports in some manner, whatever it is, that just can help highlight your personality, even if it's a little bit outside of medicine. That's always good because you're matching as a person, not just a med student and future doctor into these programs. And the programs want to know you as people that they're going to enjoy being around. So try to bring that through your personal statement as well as when you're interviewing. And I think that will go a long way as well. So I hope these tips were helpful overall for if you're trying to match into a desired residency. Leave your comments below if you have any questions and you want me to go into something further. If you feel like I missed something, I'd be happy to answer it in a follow-up video. And please like and subscribe if you're enjoying this type of content. I look forward to hearing all your success stories, and I'll see you in the next video.